Thank you for purchasing Accu-Dent System 2 for dentate impressions. To ensure superior results like these, this presentation will demonstrate various time-saving steps and techniques for taking a superior impression, including tray selection, operatory setup, maxillary impression, and mandibular impression. Your kit includes a complete set of maxillary and mandibular accu-trays, a box of syringe accu-gel, a box of tray accu-gel, 2 syringes, a water measuring vial, a tray holder, thermometer, 2 soft pressure tip applicators, 2 medium pressure tip applicators, finger grip extender, and a complete set of Accu-Dent System 2 procedural documentation. The procedure for System 2 accu-tray selection is virtually the same as metal stock trays. However, the selection is more precise because there are 2 choices of size in each category of small, medium, and large trays. For maxillary trays, choose a tray that has buccal flanges that easily clear the molar teeth or the edentulous maxillary tuberosities. For mandibular trays, the lingual power flanges should easily clear the inner surfaces of the mandible. For patients with large lingual tori, the trays can be easily modified by adjusting the power flange with a handpiece and burr. The suggested operatory setup for one impression includes 1 open package each of System 2 syringe and tray gels, 2 mixing bowls, 2 spatulas, 1 syringe with the pressure tip firmly in place, a water measuring vial, the selected size of the accu-tray, water at 80 to 85 degrees Fahrenheit or 26 to 29 degrees Celsius, and gauze. The mixing sequence is the same for maxillary and mandibular impressions. Measure out 80 to 85 degree water to the second line on the water vial and pour into the smaller mixing bowl. Fill the measuring vial level with the top and pour it in the larger bowl. Empty the syringe accu-gel powder into the small bowl with water. Spatulate for 15 to 20 seconds until the mix is smooth. Always begin with the syringe accu-gel since it has 30 extra seconds in setting time, which allows an operator to work alone or with an assistant. Backload the syringe with the spatula and replace the plunger. Push the plunger up until the syringe accu-gel fills the pressure tip and set aside. Empty the tray accu-gel into the larger bowl with water and spatulate. The mix will appear very dry, but it is important not to add more water. The mix will become smoother as it is spatulated. Load the upper tray from the back, pressing the material through the retention holes. Make sure that most of the tray gel is in the anterior of the tray, sloping back to a reduced thickness in the posterior. Shape the tray gel and pat out creases before wetting the surface. Hold the loaded tray under cold running water, gently rubbing the surface for 5 to 10 seconds until it is smooth. With a piece of gauze, dry the buccal and labial vestibules and the vault of the palate. With the syringe, place the pressure tip firmly on the occlusal of the most distal tooth and pull the pressure tip toward the anterior. At the cuspid, rotate the tip 90 degrees and express gel directly against the facial surfaces of the anterior teeth, stopping just past the midline. Repeat the procedure on the other side of the arch, overlapping the midline. Firmly wipe the pressure tip across the lingual surfaces of the anterior teeth from cuspid to cuspid. Remove the pressure tip from the syringe and have the patient relax their upper lip. Express syringe gel into the vestibules from the hamular notch forward to the midline on one side of the arch and then the other. Place a small amount of gel into the anterior of the vault of the palate to prevent an air void. Carefully center the front of the filled tray on the midline and push upward in front until a small amount of the tray gel merges with the syringe gel. Push the back of the tray upward until the tray gel appears beyond the distal border of the tray. It is important to stop any further pressure so as to not overseat the tray. To border mold, simply grasp the philtrum at the vermilion border of the lip and pull straight down. Gently stretch the upper lip and cheeks down over the labial vestibule and the buccal frena with the flat of the fingers. In distal extension cases, have the patient open wide to physiologically mold the posterior periphery. When both impression materials are set in their bowls, break the impression loose at the distal buccal periphery and remove carefully. Use of the handle alone may cause the dislodgement of the impression material from the tray. Next, disinfect and pour the model within 5 minutes. For a mandibular impression, load the lower tray filling to the bottom of the lingual flanges. Overfill the tray where it opposes edentulous ridges. Shape the tray gel and pat out the creases before wetting the surface. Give the tray gel a surface wash by holding the loaded tray under cold running water and rubbing gently with your fingers. Wipe the mandibular buccal and labial vestibules with gauze. With the pressure tip, express syringe gel from the occlusal posterior teeth toward the cuspid. Rotate 90 degrees and prep the facial surface of the anterior teeth just past the midline. Do the same to the other side of the arch. Wipe the tip across the lingual surfaces of the anterior teeth from cuspid to cuspid. Remove the pressure tip from the syringe and place syringe gel into the buccal and labial vestibules, starting near the retromolar pads and extending forward to the midline on one side and then the other. Center the filled tray on the midline and push downward in the front until the tray gel merges with the syringe gel. Have the patient push their tongue forward and push the back of the tray downward until the tray gel appears at the distal border. Stop any further seating pressure. When both impression materials are set in their bowls, break the impression loose at the distal buccal periphery. Using the handle alone can dislodge the impression material from the tray. Next, within 5 minutes, disinfect and pour the model. These are some examples of the accurate results you can achieve with Accu-Dent System 2. As you can see, this system allows you and your laboratories to make more precise restorations from better models, which will reduce the number of chairside adjustments later. If you have any questions, please contact the Ivoclar Vivadent Technical Sales Group at 1-800-5-DENTAL in the United States or 1-800-263-8182 in Canada, or visit our website at www.ivoclarvivadent.us.com. Ivoclar Vivadent thanks you for your support.